What psychiatric medications do you prefer and why?
I think that's a tough question because people come in, they come to see me, they'll, you must have something, right? You're the COVID psychiatrist. And I kind of treat things similarly to how I treat other mental health conditions. And I try to be really, I've kind of talked about my evaluation kind of stance and focus, and I try to be really thoughtful about how all the symptoms fit together. So you're not going to see me throwing medications at symptoms that often. That doesn't mean I won't use medications to target sleep or anxiety, but I try to be like, okay, why are you, what is the quality of the sleep disruption? Why are you having it? What is the quality of your depression or your anxiety? Where is it coming from? How do these pieces fit together? And then I try to target that sort of formulation, as we call it in psychiatry, with medications. So I won't often, like someone will come in and say, I have brain fog. I won't go straight to a stimulant, for example. I get asked about that a lot. And maybe eventually I'll be kind of outed as being overly conservative. That's being actively studied right now. But I'm just finding that it doesn't really do anyone's service to sort of throw a med for every symptom. So I try to be like, okay, you're having depression. Let's take a look at that. Does it feel, when we score you, does it seem to meet criteria for major depressive disorder? Is it more of a psychological depression from trauma? Is it sort of depression because you're not, you're not eating well, you're on oxygen, your sleep's disrupted, maybe you have sleep apnea. And then I try to target the underlying condition. So if I do think it fits like a major depression or a generalized anxiety or PTSD, I will use kind of conventional antidepressants that I would use anyway. Sometimes I will lean more towards the activating ones if the patient also comes in saying, I really am so exhausted, you know, having extreme fatigue. And so then I might reach more for like, fluoxetine, bupropion, activating ones like that. But in general, I try to figure out what's the side effect profile, what are the medical comorbidities, what does the patient also want targeted, and how can we kind of collaboratively make a decision together. So lots of antidepressants happening in my clinics. I'll be curious to see what the SSRI studies say, because people are messaging me. And I'm like, I'm using lots of those. Hard to say if they're kind of progressing any faster than the folks I don't have on that. I will, like I said, use some sleep medications, trazodone, melatonin, things like that. If they're having kind of trauma symptoms, I'll use kind of prazosin like we do for trauma-related nightmares. And then occasionally I'll use stimulants. I've usually been using them, and I've had a lot of patients where it turns out that they probably had ADHD all along. It just was mild enough that they could deal with it or compensate, and then COVID tipped them over. So I've used some stimulants in those, or if they have like a sleep disorder, I might use modafinil or things like that. So really, I kind of use a wide range. And then also, yes, I've started using a low dose naltrexone that a lot of people have kind of looked into for things like chronic fatigue, inflammation, and we use like tiny, tiny doses to try to target that kind of holistically. And some patients have really liked that, and some have said, I don't know if it's doing anything. So we try to do a combination of things.
Yeah, you're such a good psychiatrist. You really look at the whole person. It's just so refreshing.
I try,
And
it's hard.
no, it's great. And you've got such a sunny personality, I think just being around you, it kind of is uplifting in itself. Um, could you please tell us about your group therapy services for long haulers?
We're really proud of our group therapy. That's one of our longer standing offerings and really some of our most popular with our patients. They're like, this is the thing. Like, yes, all the doctors, you all were great, but this group is really what's changed my life. And so we love that. So we have right now two different COVID groups, and those are the only long-term portions of our clinic. So we kind of allow folks to stay in those as long as they want to and are actively engaged. And then naturally over time, some people get better, they get busy, and then we kind of add new group members. And those are really, we call them emotion focused processing. So the idea there is to have a safe space where we have like therapists and psychiatry facilitators. So they're there to make sure the group kind of stays on track and is a safe space to kind of talk about how are you feeling? What is happening in your life in the context of COVID, right? What's changed, not changed, and be able to kind of talk to other people that get it really and share frustrations like, here I am dealing with long COVID, and there's my family member going out not masking and partying and doing all these things. Or really, what was fascinating was that some of the early things we learned about long COVID came from that group. Like I remember really early, some of my women patients being like, I'm losing my hair. And we hadn't yet written about that in the literature, that that was a thing that could happen. So that's a sort of space happening there. And we kind of introduced some skills, ways to cope with things, kind of things like that. And then we have a chronic illness group that we had created pre-COVID, but lots of our COVID folks do rotate, like go through that while they're waiting per space in our other group, because as you can imagine, we have wait lists for that as well. And we're so full that we are working on creating a third COVID group that'll be more time limited and more skill and knowledge based to kind of give people a foundation to work with while they're getting connected with other forms of therapy.